and welcome to the Cat Doctor. Come on in, we'll give you a tour. When you enter our hospital, you'll notice that it's quiet and calm and clean. We have everything that we've done here at the Cat Doctor has been made to be cat friendly and also client friendly as well. Come on in. And this is our waiting area where you can make yourself at home. We tried to make it as cat friendly as possible. We have our birds, our finches, and our canary Rosie. We also have a fireplace, which is nice and relaxing, and it puts out some heat in the winter time. And television if you need to wait for any test results, as well as a beverage station to get some refreshments. This is Elda. She's acting as receptionist today. She's also one of our licensed veterinary technicians here at the Cat Doctor. Come on in, we'll go in one of the exam rooms. And this is one of our exam rooms. Everything also is made to be cat friendly. We have fish in the exam rooms to entertain the kitties while they're here. And we also make sure that every kitty has a nice, comfortable fleece to sit on during their examination. This is where we'll have our consultations. We'll discuss your concerns for your kitty. We'll do a full physical examination. We'll do some procedures here as well, sometimes drawing blood or giving fluids or medications if your kitty needs that. Follow me and we'll show you the rest of the hospital. This is our second examination room. Very similar to the first one, also has a fish tank and a little bit larger bench seating area for larger families that come to the hospital. And we'll come back to the treatment area. This is the hub of the hospital. This is where most of the work gets done here. We have a full diagnostic lab. Elda's working at the microscope right now, taking a look at a urine sample from one of our patients earlier today. We can examine urine samples here, stool exams, skin cells, looking at samples from masses here as well. We have a full in-house blood lab, which allows us to get results for sick pets pretty quickly, so we can institute treatment right away. Next to the blood lab, we have our wet table. This is an area where we'll do treatments that might entail getting dirty. Dental cleanings, taking care of cats that may be constipated will occur here, and other miscellaneous treatments. On the wall behind the dental table is our x-ray unit for oral x-rays. This is really important for cats, as a lot of disease in cats is actually occurring in the root structure of the teeth. So we want to be able to evaluate that. And at the Cat Doctor, we take x-rays of every cat that has a dental cleaning here. Behind you here, we actually have our hospital ward. And this is a quiet room where cats who are hospitalized for the day for some reason, either undergoing a procedure or under treatment, would stay. Every hospital area has a elevated bed that the cats can either perch on top of or sleep underneath of. And there's plenty of room for litter box, food and water, and special toys. Next door to you is our isolation ward. This is a special ward for cats that might have contagious diseases. The fronts of these kennels are glass to prevent any spread of sneezing and things that a cat might produce that could infect another cat. This room also has a special ventilation system to exhaust the air out of the building so that we don't spread that around through the hospital and infect other cats. We have glass doors on both of these rooms, which allow us to observe the patients from a distance without actually having to interrupt their sleep. This is our imaging room, and this is where we have our regular x-ray films taken and our ultrasound machine. This allows us to take a pretty complete picture of what's going on with your cat. And behind the x-ray room is our sterile surgery room. This is the room where any sterile procedures would take place. At the Cat Doctor, we believe strongly in the safest anesthesia possible for your cat. So all animals, or all cats that have surgery at the Cat Doctor, have pre-anesthetic blood work to make sure that their liver and their kidneys are functioning well before surgery and that their blood counts are good. They also receive IV catheters and IV fluids during their procedures. For our patients, we have a special warming device which keeps them warm during the procedure, as this is one of the biggest complications for cats that are under anesthesia. On our anesthesia cart, we actually have a monitoring unit which will assess the heart rate, respiratory rate, temperature, run an EKG, and also check the oxygenation levels of your cat. And also critically, we have licensed veterinary technicians on our staff which will be monitoring your patient during their surgery. And this concludes your tour of the Cat Doctor of Monroe. We look forward to seeing you soon.